Hi everybody, today I want to talk about something called the lateral brow lift, which is a very popular, well-established procedure, in particular when you want to raise the tail of your eyebrows. So when you have some lateral hooding on the sides, when it looks a little bit heavy, and just doing upper left wouldn't necessarily be enough. Now, a lateral brow lift is performed in your hair, if you have hair, haha. And you basically place a small incision. You see first and foremost how does the vector of aging, if it's a rejuvenative brow lift, affect the area. You place an incision about 2 centimeters max in length in the hair-bearing part of the skin, and you release all the ligaments. There are ligaments that is called the temporal line, there's a ligament around the eye, it's called the orbicularis retaining ligament. These ligaments need to be released because they work a little bit like an anchor between the bone and the skin. And in order to lift everything up effectively so it stays up, you have to release these ligaments. Then everything is repositioned. Now it's important to understand that the aging vector goes in 3 different directions. So we have to actually lift a lateral brow lift in 3 different areas, in 3 different vectors, in order to create a most natural appearance. The center of the brow comes together as we age, the tail drops, so we have to bring these 2 vectors together and then an intermediate vector for the breaking point of the brow. This is done and we anchor everything to the deep tissues and we close everything. Now, if it's a young patient that is asking for lateral brow lift, then one thing that is important to consider is also doing maintenance on the movement that is pulling the brows down, meaning Botox in these areas, because as you're young and your muscles are very strong, over the years, whenever you smile and frown, you're pulling on the tail of your brow, counteracting the lift. So in order to have a better outcome and more longevity on the outcome, you have to consider having some Botox after the surgery in order to keep the brow where it is and not have your muscles pull it down. Thank you.